So we will have 2 minutes for your questions and answers. Nisha Pujari. So I have one question for you, Nisha. You mentioned that in your program you screened them for HIV and STI. So what particular STIs were screened?
It's normally for syndromic,
Okay.
screening. Yeah, and HIV testing. It's a
Okay.
community-based program. So in the outreach, the team goes and they screen for STI, syndromic,
Okay. It's
and
just the symptom
yes,
screening.
and
No?
the HIV testing. And if
Okay.
there are found anything, then they would be referred to the government hospital.
Oh. Any other questions? Thank you very much.
Okay, the next is from the second presenter, Dr. Sapramadu. If you have any questions from Dr. Sapramadu, please ask your question.
So, in the
Sapramadu, there is no questions to ask. Yes.
third speaker is Purvi. Yes, Purvi. So, any questions from Purvi regarding the presentation on understanding the needs and experience of transgender individuals, a mixed method study of Pune branch?
Thank you so much, Purvi. It was a very informative presentation. I wanted to ask you, you mentioned pre and post care it's still not available, and your clinic is providing it now. So how are you managing the cost? Because you got the funding for 1 year, and what are the better ways to manage the cost after the funding ends, or if the funding is not sufficient? Because I'm also trying that to do in Pakistan, so it will really be helpful.
Question from a sister to a sister. Thank you, sister country, sister sitting next to me. Thank you so much. There are two questions. The first thing is that are we offering pre and post surgery consultations and counseling as well? As of now, we are not having that service with us. Okay, but wherever the services are happening, we are trying to make that at least our team can go and assist them, because there is one very well-known private clinic set up in Pune which is offering these services for last 40 years. WPATH guidelines have come 10 years ago or 15 years ago, but that clinic is known for Nirvani and the other castration services. That clinic is known, but they do not follow any services. We are trying. We had like 3 meetings with them, trying that they should start following those regulations. At least they are not, at least they are not doing it, but we are trying. Okay, so we have not stopped it. And there is one medical hospital, bigger hospital, Bharati Hospital. We have tied up with them, and so pre and post care counselings are done there. So there is no money involved in that. First thing. Second thing is that always for having such kind of projects, it will come on a project basis. So you have to have a vision of running that clinic after 5 years, 10 years as well. So sustainability can come from cost recovery basis, that we are charging 700 rupees, which is a very, very less amount. But of course, that amount can be used for refurbishing the thing. And there are some other ways of local fundings as well. Like CSRs are also coming forward to support LGBTQI community initiatives. It's in very minuscule level, but we have to go to 10 doors. Only one door will open after that. So that's the only thing, and we always have to have that sustainable thing in your mind.
Thank you very much, Purvi. I think I should congratulate you on your great work, because it's a very good initiative. I mean, that is what the community strengthening means, isn't it? And the strength and the building capacity of the community is very important. Do anybody provide you technical support to train your staff and all that? Because these transgender services involve a lot of technical specialities as well.
So technical support was given by IPPF for some time being. One. Secondly, HQ is always there to support us, because wherever we are lacking, we ask to headquarters of FP India, and they directly come up with a solution, at least in a primitive level. Because so if at all we were seeking for hormonal therapy treatment guidelines, we had no guidelines with us. But overnight, she contacted one of the experts, and that's how we created smaller level guidelines. But at least we could start the work. That was
Simpler.
one. Yeah, yeah. Simpler format. And at the same time, when you start working, there are some other people, like my doctor who is providing hormonal treatment. She is working with some other competitive organization, but she is serving as a doctor at our clinic, because we are like, there are so many clients those who are coming to my clinic rather than those clinics. So she agreed to help us, and she's still with us, although she is working on a very big post on that organization, like at that organization, but still she's working with us. And if at all she cannot come, she creates a pool of experts those who can come and help us. So that's how, like, once you start working, people will come to help you if at all you go with your dedication 110%.
To add, we have also how SRH providers can provide gender reformation services, information, and referrals to the community. So our staff are trained. If a person from the trans community comes, how to counsel them. How to help them. To understand their identity, or whether they really wanted to go for a gender reformation services. Those things are there. Along with that, there are other things are also, like changing the name. So we have developed the guidelines with the help of experts, so that gives entire trans people needs to a SRH service providers. So it is easy for a SRH service providers when the community members come to our clinic to provide this information. Of course, we have a strong referral, as Purvi said, with other organizations, because we are a SRH organization. We can provide a good counseling information along with the partnership with others for their other gender related services. So these are the guidelines. If anybody is interested, please write to us. We can share the soft copy of that.
In a way, Sri Lanka is fortunate that we have government-funded psychiatric clinics providing the transgender services, and also endocrinologists providing the hormonal care as well. But I know that the services are limited and they have to sometimes wait in the waiting list.
We can say
Restrictions are
services
there.
are too limited, very much limited, because the hormonal therapy is yet to start in Sri Lanka full-fledgedly. Whatever the drugs are available right now, I would urge that the government should pay attention, because in one of my slide, like, I had that thing, but I couldn't mention that many a times when it comes to LGBTQI services, government takes a stand that this is not so important vis-a-vis the burning points or boiling points, political pressure, other things. These needs of LGBTQ community and particularly transgender community are perceived as not so important thing, but also it's a life. I have presented this paper today based on many incidences which are life-threatening for transgender community. There are so many deaths associated with. I was just talking to Dr. Ratnamala Desai, who is our president for Family Planning Association of India. So we were having a conversation over the deaths during the surgeries, because of surgeries, and because of hormonal therapy as well. We are in a dangerous situation. So we have to have a very good comprehensive service package or model for saving transgenders' life, because every life matters. We are hearing it like, leave no one behind. We are already behind. So I urge that, Sri Lanka should look into it.
Thank you, Purvi.
Thank you very much for your explanation and answering questions. And the next is from Kalara Pereira and her colleague. And are there any questions from them?
I have a question for you. Based on your research finding, do you have any plan? Because it's very important to do young people engage in such topics, and your insight or whatever your findings need to be incorporated into our actions regarding the young people influence in sexual and reproductive health. I think it's a very important aspect you all have highlighted. So any plans to implement, do some influence in the social media to, because the research always should lead to actions, isn't it?
Yeah, of course. It's just that the two of us, we are not influencers, but we found this interesting because we thought that it's interesting that across the region, we were looking for influencers who solely focus on SRH, and we could only find them mostly. I mean, we might be wrong, but most of the mainstream influencers who talk about SRH are only from India, which we found to be quite sad, actually, because we thought it's such a contemporary topic that needs to be talked. So since we are not influencers ourselves, I think we might have to start from the ground, like from the ground, if we were to start something. But we would really
So I
encourage
think
influencers
from your point of
with
view,
the
you can
reach.
advocate the
Yeah.
others who can do
Exactly.
it. So your research to actions.
Yeah. Those with the reach could perhaps start talking about these things, even if it doesn't need to be exclusively about SRH, because that would be a big step to take. But if they can start from somewhere, I think it would be really good.
Thank you.
I think one of the speakers here also actually, once we ended our conversation, she was like, maybe you guys should start somewhere else, start your own page. So yeah, I guess that's where we have to start, I guess. Yeah. Thank you.
So
Thank you very much.
It's the question time for our last presenter online. If he's online, Abhishek, any burning questions for Abhishek, because we are running behind time. Okay. In absence of any questions, we would conclude the session. Thank you very much for all the presenters. To wrap up everything, I think it's very important to share our experience among each other and learn from each other, especially to combat HIV and STI, sharing our experience among the professionals and among the community workers. It's very important. I think we all learned a lot during this session. Hope we can have more sessions in future as well. Thank you.
This is the time to award certificates. I kindly invite our esteemed guests, our esteemed co-chairs, Dr. Yakandawala and Dr. Geethan to the stage. Miss Nisha Pujari, our first presenter. Dr. Samandika Sapramadu. Praveen Sonauni. R.K. Ravendra Kumar and M.K.N. Pereira, co-presenters. Yes, thank you. Our final presenter is online. We cannot award a certificate to him at the moment. Mr. Abhishek Pratap Sen. Ladies and gentlemen, thank you to all our presenters for their insightful and engaging presentations today. It has been a privilege to learn about the diverse research and innovative ideas shared in this session. I would like to also to extend my gratitude to our esteemed co-chairs, Dr. Yakandawala and Dr. Geethani, and the audience members and everyone who made this session possible. Your contribution and support are greatly appreciated. We hope you are continue to engage with ideas discussed today and carry them forward in your work. Have a great evening. Thank you.